Good afternoon, everyone. Welcome to our June 18th webinar for the CDAPP Suite Success Resource Center. My name is Cynthia Pena. I am the manager for the Resource Center. So today's topic is a Resource Center program and affiliate update. I will be your presenter for today, and like I said, I'm the manager here. So what I would like to do is give you a quick summary of how many Memorandum of Understanding we've received, review the information that you all of our affiliates submitted in their annual site survey, and this is information that we have received as of May 30th. I'd also like to mention or share with you a couple of interesting articles and abstracts that I have recently run across. And then again, we've discussed this before, but I want to go over some changes to the Resource Center activities. Okay, so first we received 130 MOUs, or MOUs for 130 sites, and this includes the satellites. You can see from the map of California where our affiliates are currently located. You'll also notice that you can see that there's a couple of counties that now have a 0 next to the name. Those are counties where we had at least one affiliate site last fiscal year or last calendar year, and those particular affiliates did not renew or resubmit their MOU. So that would be Lawson, Humboldt, Contra Costa, and I think there's one other one in there, but I can't seem to find it right now. We now have affiliates in 38 of 58 counties, and as always, it's our goal to create or to support affiliates in every county. So that's going to be part of the work for next fiscal year. Now our affiliates did drop. We went from 165 last reporting year to 130 this year. We did have several actually, who called and said, we are losing funding, we are losing staff, we are physically going away. The rest just did not respond to any of our emails and or phone calls. Everybody who sent me both an MOU and a site survey has been mailed a certificate of affiliation and is now in our website's affiliate finder. If you believe that you submitted both and you did not receive your certificate, or you cannot find yourself on the affiliate finder on our website, please call me as soon as you can so that we can get that straightened out. One of the things that has not changed is that there is a big emptiness of affiliates right in the middle of the county. Amador, Alpine, Calaveras, Tuolumne, Mariposa, and Mono, there is nobody there. And the counties surrounding it don't have huge numbers of affiliates either. So that will also be a focus for next fiscal year or next calendar year. And then Fresno went from 2 to 1 affiliate, which I find a little concerning because of the high-risk population in Fresno. So the next piece of information that we have is on the number of clients or patients that have been seen by our active affiliates. We received 80 surveys, which were submitted for 110 of the affiliate sites. 65 of those surveys they submitted complete information, and the rest had partial or no data. The total clients seen was 21,371, and that is an increase from last reporting period. So we may not be working with as many affiliates, but the affiliates that are out there are seeing more patients. And one of the interesting things that I did notice is that the proportion of patients have changed. we are now seeing more type 2s, or we're getting data information on more type 2s than we are on gestational diabetics. So last reporting period, we had 10% type 2s, and now we're up to 16. We had 88% gestationals, now we're down to 83. And the type 1 is also down a little bit, that went from 2% to 1%. Now, I don't know why that happened. I don't know if more of our type 1s are being referred out, or if fewer type 1s are getting pregnant, which I kind of doubt, but we really don't know the why. All I can tell you is what has changed for our affiliates. The other thing that I wanted to show you about our patient population is the distribution of clients. So the color coding is showing you how many clients are being seen in each of these regions. The red regions, or the red counties, are seeing more than 1,000 clients within all of their affiliates. So, for example, Los Angeles County has 8 affiliates, and between those 8 affiliates, they saw more than 1,000 clients. These right here, Stanislaus and Merced. The reason the coloring is a little bit off on this one is that these clinics are all part of the same system, and the data that was reported was in aggregate. So I can't tell you exactly how many were in Stanislaus and how many were in Merced. What I can tell you is that this system of clinics, between all of their clinics, saw anywhere from 500 to 750 clients. We saw some of our affiliates saw as few as 5 patients, and some of them saw as many as 3,000, I believe, was the one that had the most. If anybody's interested in more detailed information, let me know. I'll work on getting some of that out. And it might be next fiscal year, but we'll do our best. The next group of information that I received, or piece of information that we received from 110 affiliates, was regarding the makeup of their affiliate staff. So there are 270 affiliate staff representing those 110 affiliate sites. 48% of our affiliate staff is nurses, 39% is dietitians, 10% is other, and other could be a physician or a community health worker or anything that does not fall into the other 3 categories. And then 3% is BMS, or behavioral medicine specialists. We have a slight change in the proportions of the disciplines also. We have more RDs and fewer RNs. Our RDs went from 35% last year to 39% this year, and the nurses went down a little bit, down from 53 to 48. So now, one of the things that we did ask about the affiliate staff was how many hours of continuing education they were receiving throughout the year. And what we did get back is that those 427 staff have received 1,437 hours of continuing education, which is impressive. That is a lot of education. So actually that was 270 affiliate staff. That's a lot of hours. We are finding that our staff is continuously trying to improve what they know and who they know and what's going on, and better serve their populations. However, there is one thing that I do need to point out, and that is concerning to me, is that of all of those hours, only 477 were CDAPP webinars. And part of the agreement when you signed your MOU was that you agreed that existing affiliate staff would receive at least 4 of their continuing education hours from CDAPP Resource Center webinars. and new staff was going to receive at least 8. So I just wanted to remind everybody that it's great that you are getting all of this education, and the more education the better. However, we do have to make sure that 4 of those hours are from our webinars and 8 hours for the new staff is from our webinars. Now, as we were looking at the data that was sent in, there were a couple of items that we saw as common issues, things that kept coming up over and over again. One of them was partial data, where I'd get total numbers of patients, but no breakdowns on the type of diabetes that they had, or that we had information on new clients, but not on clients that were coming from, that started the previous year. Or I would get names of staff, but no continuing education information. The other issues that we are seeing is that the number of patients is not being collected consistently or uniformly, and I've kind of mentioned that a little bit. And then some of the affiliates can only retrieve data based on date of delivery. So I think the problem is multiple-fold. If your data system doesn't allow for you to retrieve the information, that we can't get it, and we're still not all collecting information either on paper or on a spreadsheet uniformly or in the same manner. So I did create a data sheet that I believe is already posted, and I will send out with all of the other follow-up information next week. This is an Excel spreadsheet, and basically just enter a line per patient. This is an example that I started to fill out for everybody. The information down at the bottom, so that the orange is the continuing from prior calendar year, the blue is the new, and then the information down at the bottom is an automatic addition. There's a formula in there, and you can take that information and put it into our affiliate site survey. And again, if you would like me to, I will send it out to everybody. If you don't get it, if it doesn't open, if you'd like to post it on our website, let me know, and we'll get all of that done for you. There are a couple of questions that we've received more than once throughout the year. As I'm getting questions and responding to questions, I always reference our guidelines for care first, and if it is a treatment or a question that is related to the guidelines, I will tell the person that I'm talking to where I found the answer so that we can find it again later. I will consult with our state staff if there's something that I don't know, or with our Sweet Success clinic experts. We do multiple different sources of information so that we're conveying as complete information and as accurate as possible.